My name is Michelle Trench from Avenue Health, and welcome to this presentation. This work was conducted together with my colleague Stephen Forsyth. So this presentation basically focuses on the early impact of COVID on two targeted sectors of the Burkina Faso economy: cotton production and gold mining, as well as the revenues from the exportation. A simple Excel tool was developed to answer questions about the potential economic impact of COVID-19. The work was completed in August 2020 during the first year of COVID-19. And when this economic analysis was initiated in April 2020, Burkina Faso was already in lockdown. While our modeling team at Avenue Health was evaluating the cause of the epidemic in Burkina Faso, the economic team was assessing what the pandemic will mean for the country's economy. And at the time, we noted that the price of gold, the single largest export of Burkina Faso, has increased drastically. Also, on the other hand, the second largest component of the economy, which is cotton production, was suffering from dramatic decline in the price. So we saw mines shutting down, borders closing, imports of fertilizer and seed stopping. And we noted that workers were not able to travel within the country or to travel between neighboring countries. And in this light, we work with our consultant in Burkina Faso, as well as the stakeholders, to assess how the economy was likely to be impacted. So this slide presents four key steps. And I will start by asking you to please think about which are the steps that are missing here that were not followed. So just think about it for your question. So this slide presents four key steps for a successful framework when conducting modeling or economic evaluation, and they were all followed in this activity. There was a desk review that was conducted using national and international documents, and there was key informant interviews to verify collected data with cotton and gold mining companies in the country. Then the data and the scenarios were developed and validated with stakeholders during some in-person meetings, as well as it was also virtually because we did not travel. So the first step was engaging with Burkina stakeholder, encourage consensus, customize the analysis as developing the tool. As I mentioned, one of the most important export-driven sector in Burkina Faso economy was cotton, and where about 54% of the country's labor workforce are directly or indirectly involved. So we developed this economic model in Excel to investigate various scenarios of the short-term cost of the cotton production in the country. And this table illustrates the scenarios that were analyzed for the cotton through 2020, through the end of 2020. So for the baseline scenario, cotton production in Burkina Faso was assumed to drop by 7.5%. So I was about to talk about the baseline scenario where cotton production in Burkina Faso was assumed to drop by 7.5% relative to the previous year. And based on projections that were made at the beginning of the year, there was a projection made at the beginning of the year that cotton production could drop by 7.5%. That was before COVID became relevant. But for our most optimistic scenario, we assume that cotton production would then drop by 5% in relation to the baseline. The scenario 2, we also see prices return to January 2020 level by the end of the year, but predict a much larger decrease in the cotton production. All in all, the analysis showed that cotton loss as a percentage of the overall GDP attributable to COVID-19 was estimated to be between 6 and 13%. Here, the GDP of Burkina Faso was predicted to drop by something like 945 million at the beginning of the year, because they have assumed that the GDP will grow by 6%. And then later they concluded that due to COVID, it's going to only grow by 2%. So there was a loss of about 630 million. And this analysis was based on that loss, and it was showing that the loss attributed to COVID-19 from cotton could be between 6 and 13%. Next slide. So this is the result, just shown graphically what I was saying, and then here we have the amount in US dollars for each of the scenarios. So for this is for gold mining now. So mineral mining in Burkina Faso is dominated by gold mining, which is one of the most dynamic economic sector. And gold has been the country's leading export commodity since 2009. The mining industry employs a considerable workforce, which with many people indirectly benefiting from mining. And again, we created an economic model to project the short-term impact of COVID-19 on gold mining. So this slide, this table illustrates the scenarios that were analyzed for gold through the end of 2020. In the baseline scenario, gold export in Burkina was assumed to be the same as in 2019 in this case, based on projections that were made at the beginning of the year as well, before COVID-19 again became relevant. Our scenario 1, which is the most optimistic scenario, export will drop by 5% relative to the baseline, and the price will remain the same from August to December, because as I said, the study has ended in August 2020, but we projected that the price will remain the same from August to December. Our scenario 2 sees export decline by 10%, while our scenario 4, which is the most pessimistic, saw gold production decline by 20%. So after the analysis, we found out that gold export revenue, because the price of gold was going up, could compensate the projected GDP loss between 5 and 74%. So 5% for the first scenario, where we see the cotton production drop by 5% relative to the baseline, and 74% for our most pessimistic scenario. So this is the result shown graphically, where we now have the amounts that export from the export revenue from gold based on the various scenarios. And as you can see, the baseline, our status quo was the same as in 2019, because that was the projection made at the beginning of the year. So for there's an extensive report on this study on the link that you have on your screen there. As I said, this was conducted with my colleague Stephen Forsyth and myself. So if you have any question, I'm here to answer them. Thank you. Or you could post them in the chat. Yeah, and if there's no question, I could start by, I did ask you when we got on my second slide that are there any missing steps that you saw in the 4 that were following this process? So yeah, I saw a hand up.
Yeah, thank you, Michel. Very interesting presentation. I wanted to know whether the results that you presented are at the macro level. Was there any consideration, or do you have any information on the impact more at the micro level, particularly on employment or incomes of people employed in the 2 industries? Thank you.
Yeah, thanks for the question, Scott. So no, the answer is no. We actually did not do this at the micro level, where we look at the impact on individuals. So, but we knew that people were severely impacted because they could not move, they could not earn revenues from these 2 main sectors of the economy, specifically due to the lockdown, where they could not even do any other activities, but we did not look at that sector. And one thing I may mention is that while this study was being conducted, there was several other studies being conducted by different organizations in Burkina Faso. So maybe somebody might have looked at that. Thank you for your question. And as I said at the beginning, I was asking, was there any step that you saw missing there, or how do you envision using a similar analysis in your context? Is there anything that might interest people to use this kind of analysis in a similar context? It may not be COVID, but it might be something else. And my second question would be, given the economic impact of lockdown or that pandemic measure taken, how do people think the world may respond differently to future pandemics? So this is just to kickstart the discussion.
We do have another question in the chat asking if you could please expand on how the results have been used and what was the impact.
Okay, first of all, I did ask the question, was there any step here? So first, when this was being conducted, it was shared with the team in Burkina Faso. But as I said, several studies were being conducted, so we did not hear back, but this was acknowledged that it was well received, but we did not hear back on how they use it or what exactly they extracted from it at that time when it was shared with them, because we're working with a consultant there who was interacting with the people at the Ministry of Health and all the folks that were interested in this study, but they did not come back to us to tell us what was of interest to them, but they acknowledged the receipt of this and thank us for the study.
Thank you so much, Michelle. I think we have to send everyone back to the main room.